Thank you, everyone. Good afternoon. Maybe I could invite Lars up onto the stage for an exciting conversation. Should we sit on this one, Lars? So thank you to Rumbi, to Dr. Ngozi, and of course to Lois, who joined us. That was a fascinating conversation, and I'm delighted to be joined by Lars Hartenstein, who's co-leader at the McKinsey Health Institute. Lars, a warm welcome. A big thank you to McKinsey Health Institute for its support in really helping to power our journalism here in Geneva this week. Perhaps we could start with a scene setter, MHI. It's a mission-driven global health entity within McKinsey & Company. You're seeking to help advance an additional 45 billion years of higher quality life. That translates to something like 6 years per person around the globe. We know that you're leaning into the idea that health is more than just the absence of disease. So could you explain what that means for our audience and maybe unpack some of the characteristics that MHI really attributes to health?
Yeah, thank you, and very happy to. Maybe just a quick link for the with the conversation earlier, where we talked about health equity. Essentially, I'm not going to talk a lot about health equity, but health equity is a very important lens to everything that I'm going to talk about in this big step back. So for those interested in that topic, good to have it in mind to maybe come to it at the end. So let's take a step back and think about health and what we have achieved. Since the 1960s, life expectancy has increased about by 20 years. So our children now can expect to become much, much older than their grandparents. The number of centenarians has increased 30-fold or so in the same period. So that sounds like really good news. If we define health as the absence of death and disease. At the same time, our understanding of health is really incomplete on some level. We call it within the McKinsey Health industry that we are somehow caught up in something like a healthcare matrix. So just as full disclosure, I have a background in medicine myself. I have been in global health for many years, so I consider myself part of the of this healthcare matrix myself, and we named it after the movie of the same name. If you have not seen it, I think it's already a little bit older now, but I think it's an eternal classic. I really strongly recommend to check it out.
But this is very real, isn't it?
It is very real. It is very real. And yeah, in many ways. So it's an eternal, anyway, but let's not do a movie discussion. Let's do that maybe afterwards. So, as you said, we believe there's an opportunity to challenge some fundamental orthodoxies that we held in health and then add 6 years more life or higher quality life for each person on the planet. So inside this healthcare matrix, we fundamentally are concerned with dealing with physical health problems. 90% of our resources and of our effort really goes there. However, if we step outside this matrix, we realize that mental health, not least through the pandemic, social health, and spiritual health are equally important. In fact, we asked 19,000 people in 19 countries around the world what aspects of health they value, and they value each of these aspects of health roundabout equally. Just to give you a small example how they're all also interrelated, loneliness in heart failure patients leads to an increase in the risk of mortality that is fourfold. Not necessarily an aspect that one thinks about it within the healthcare matrix necessarily. So if we take this more complete understanding of health, our perspective on these 20 years of additional life looks very different, because we realize that we are actually paying a very high price for these 20 years. For each year of increase in life expectancy, we actually, in quotation marks, pay for it with 6 months in less than good health. And this share of life in less than good health is actually remarkably constant across geographies and also time. So now if I ask again, how is 20 years more of life expectancy great news? Well, you could also say it's quite a terrible deal, because we are paying with it with years and much less good life. So inside the matrix, we accept this. Yeah? We say, well, that's the way it is. Or we even challenge and say, why do we have to become so old? Or we challenge that we are spending vast amounts of resources, at least in high-income countries, on the last 2 years of health. So, however, if we are outside, we can ask a question where we realize that there's a terrible deal, there may be something much better available. Why shouldn't we strive for spending our later years in lives with lives of meaning and purpose, sitting on the ground, playing with our grandchildren, and really strive for being in great health as close as possible until we die? And this is really the concept that is underlying this healthcare matrix.
Well, I wanted to bring in the fact that you'd published a recent paper which was called Escaping the Healthcare Matrix. You've explained what the healthcare matrix refers to, but I wondered if you could dig in a little more to some of the main drivers of health and what their implications are for the broader health sector, many of whom are represented here in the room today.
So if we are thinking about what is driving health, there's first, we need to make sure we understand it as well as possible. And we really have trouble defining and measuring and striving for health in a more comprehensive way. So outside the matrix, we realize that health really is on a spectrum where you have negative health on one end and optimal health on the other. And optimal health can be much better than just the absence of disease. You can strive to do better. You can strive to run around the block, even at a later age, even if you don't have any other diseases. You're in better health if you can function better. So that is a very, very important aspect to have in mind. We don't only have to strive for not to die, not to be incontinent, not to be disabled, but for a life where we are striving and where we can be centered, where we can be resilient, and where we can be full of vitality. So now this may sound at first, and that goes a little bit back to some of the earlier comments that I made, that it is just something for biohackers and middle-aged men in high-income countries. But this is not so, it's not like that at all, because it's really something that is for everybody. So how can we get there? Inside the matrix, we always say that health is due to genetics, chance, and especially in the global health context, very much about access. So outside, we looked at really what is driving health. And out of the 23 drivers of health that we identified, only 19 are fundamentally, only 4 are fundamentally within conventional healthcare. 19 are actually outside of it. So we are not even catching them when we are talking about healthcare in a conventional way. And what is included in that? So it's not only diet and exercises, but also things like sleep, social interaction, the media we consume, our exposure to nature, or also our exposure to, let's say, heat and cold. All of those are important. There's evidence for it. And in the paper you mentioned, I believe there's a copy outside.
So we have some copies directly outside Ballroom B. But yeah, it's a really good blueprint to escaping this healthcare matrix that you're characterizing and towards a lifetime of good health. So I wanted to just talk about the ambition of the agenda. All of the modifiable characteristics that you've described. Is this new approach to health achievable, do you think? And what are some of the concrete steps that stakeholders can take to actually get us there?
Yeah, so maybe a question to the audience. Let's go back to 2020. Would you have thought that global mask wearing could ever become a standard almost everywhere? I mean, I can tell you my answer, which is probably not. And it has become a standard globally. In the same way, if you look at, let's say, smoking rates, in this case of men how they've evolved over the last 50 years in Europe, Americas, and in, say, Japan, they've decreased by 50%. The rate of folks wearing seat belts have increased from 14 to way over 90%. So large-scale change in behaviors is not only possible, and there's reason to be very optimistic about it, it is actually the norm. So now to the question, how do we get there, and what does it also mean for the global health
obstacles
audience?
and practical solutions.
Yeah. So first of all, health is really a all-stakeholder affair that extends much between ministers of health to all ministers and their portfolios and how they implicate health. In the business side, to businesses outside of conventional healthcare and how their products and services are influencing health, as well as how, in the role of employer, as an employer, private business are actually have the opportunity to shape health. Also in research, if we think about where research money is spent, it is very much of the many drivers of health on the four, actually mostly on treatment, and not on many of the other ones that have incredibly strong evidence, but they're not as strongly researched because the incentives to the research there are not there. So we need to do more research in these areas as well. So maybe if you think about, just as an illustration of this ecosystem-based approach, if you think in global health of the most intractable problem that you're currently dealing with. Yeah? I don't know, maybe it's case finding in TB. Maybe it is HIV infection rates of adolescent girls and young women, maybe something else. I strongly believe, or we at MHI believe, that an ecosystem-based approach is incredibly powerful and it can achieve much more that draws in all the stakeholders. Because normally our, let's say, theories of change that we are applying are either let's invent an innovative product, number one, let's scale a very select number of interventions everywhere in the world. That's also something we recognize. Or maybe let's do health system, I don't want to say reform, but let's strengthen the health system and the delivery system. However, if we want to achieve these 6 years of additional or higher quality life, we really need to draw in a much broader set of stakeholders, and that will also benefit with some of the intractable problems that we currently have in health more broadly. What?
We're running a little short on time, but I wanted to give you the opportunity to give a last call to action on how to help advance this vision that you've described as an all-sector, all-industry, universal priority. What's one thing that you would encourage stakeholders to really take forward from this conversation?
So first of all, for those in the room, there's a very practical step because this paper is lying around. So basically, given that I do think it does make a good case and is a helpful source of reflection, so please pick it up. Now, more broadly, I think we need to have a much higher ambition in our daily lives to draw in new stakeholders, because we are within the realm that we are in coming to I don't want to say diminishing rates of return, but there are much higher returns in terms of what we can have in health for everybody when we draw in others.
Lars Hartenstein, thank you very much for joining us here in Geneva, and to McKinsey Health Institute for its partnership. I'd like to now hand over to my colleague, Catherine Cheney. Thank you.